Pain syndrome of the shoulder joint, chronic. In the treatment of chronic shoulder pain, distal points are also used, but they are stimulated with less intensity or not at all. The choice of distal points depends on the channel involved. The distal points are stimulated with moderate intensity, and the local points are inserted immediately after the distal ones. The local points to use are the same as for acute cases. In chronic cases, it is usually important to use the points along the small intestine channel if they are tender on pressure. So even though the patient may not complain of pain in that area, they should always be checked for tenderness on pressure. Case history: a 58-year-old man had been experiencing pain in both shoulder joints for the previous 4 years. He had been working as a car mechanic for more than 25 years. The pain was aggravated by exposure to cold. The points Li15 were tender on pressure. He did not present any other symptoms and was otherwise a very healthy and strong man. This is an example of cold painful obstruction syndrome. However, there is the additional component of stagnation of qi in the shoulders from overuse of the joints through his work as a car mechanic. This is evidenced by the fact that both shoulders are equally affected. If the pain is due purely to painful obstruction syndrome, usually one shoulder is affected, or at least one shoulder is definitely worse than the other. Treatment principle adopted was to expel cold, warm the channels, and move qi. The main points used were Li15 and Si10, with warm needle as a local point to remove obstructions from the channels, Li11 to benefit tendons. 6 weekly treatments were enough to clear up this problem. Another case history: a 50-year-old woman had been suffering from pain of the shoulder for the past 14 years. She had had several cortisone injections. The pain was located in the left shoulder joint, and it extended up to the neck and down the arm along the large intestine channel. At times, the pain also extended to the left scapula. The points Li15, TB14, channeling extra point, SI11, SI9, and SI10 were all very tender on pressure. The shoulder was very stiff and the arm difficult to abduct. The pain was aggravated during spells of rainy weather and alleviated by heat. She was overweight and her tongue was pale purplish. This is a case of cold painful obstruction syndrome. She also had an internal condition of yang deficiency and internal cold, as shown by the pale purplish tongue. In such chronic cases of shoulder ache, it is essential to search for tender points, not only around the joint itself, but also the points on the corresponding scapula along the SI channel, that is SI9, 10, 11, 12, 13, 14. TB15 should also always be checked for tenderness. Treatment principle: expel cold, warm the channels, tonify yang. In this case, the main points used were Li15, GB21, and channeling extra point as local points. Li1 as distal point to remove obstructions from the Li channel. This was alternated with TB8, meeting point of the 3 channels of the arm, because the pain involved all these 3 channels. A selection of 2 points out of the following according to tenderness on pressure: SI9, 10, 11, 12, 13, 14, and TB15 with warm needle. The treatment in this case was prolonged and results slow to come, due partly to the long duration of the problem and partly to the cortisone injections, which usually slow down the results obtained with acupuncture. However, the problem was resolved after 18 fortnightly treatments. Thank you for your attention.